cheat and look at my paper, and you guys can cheat and look at your paper for a while too, because we don't actually do all this every time we do a physical assessment when we go in to look at a patient. But for sake of the checkoff, we are going to do this. So, let me see if this bed will go up any. I don't know if it is or not. Yay, yeah. Alright. So what do we notice about this person as soon as we walk in? What's some things we notice? That's good, thank you.
They've got an IV.
They appear to have IV. They got lots of IV, lots of things going on with their IV, right? What else do we know about her?
Trach.
She got a trach. Okay, anything else?
She needs to take her dentures out.
She might need to.
Where's the phone at?
Alright, so we're going to take everything in when we first go in the room. We're going to introduce ourselves to our patient. So we're just gonna look at the general appearance of our patient. She's got her eyes closed mostly. We're gonna check her orientation, her level of consciousness. So how would we check level of consciousness? What are some things we'd ask if we can kind of wake her up?
Her name.
Her name,
Today's date.
today's date,
Where she's at.
where she's at, good, yep. Okay, so we're gonna, hello, Miss Jones, I'm gonna be doing a physical assessment on you today. Is that okay? My name's Larissa, and I'm gonna be taking care of you today. So, the first thing I'm gonna do is just start with your head. So, basically, I'm just going to, take my hands, and I'm going to just feel of her head. I am going to be feeling for anything abnormal, any lumps, lesions, any painful areas. I'm going to be, looking at her hair, looking for hair distribution, lice. You do find that sometimes. So I'll be looking for things like that. I'm looking for symmetry of her face. So I'm going to look at her eyes, I'm going to look at her ears, her nose, her mouth. So checking for symmetry. And then I'm going to palpate those temporal pulses. So if you think about the temporal pulses, that's going to be right here. And I'm going to get my pen light, which I could not find in my car this evening as I was coming over here. So I'm going to pretend I have a pen light, and I'm going to be looking in her, looking at her pupils, that P-E-R-R-L-A. That means pupils equally round and reactive to light and accommodation. So basically, if they should be the same size, is one thing it means, they should be round, equally reactive to light and accommodation. So if I bring the light and shine it directly in her eye, what should happen to her pupil? Constrict. If you put the light directly in her eye, it's supposed to constrict. So I'm going to come over here and I'm going to do the same thing. It should constrict to the same size. If we have pupils of two different sizes, then probably they have some kind of maybe a concussion or head bleed or brain bleed, something like that going on. So I'm going to look at the conjunctiva, which is right here at the corner of the eyes. For crusting, I'm going to look at the sclera. What's the sclera?
What?
The white of the eye. Now, sometimes that area might be like, if they have liver problems, what color might the sclera be? Yellow. So they may have jaundice, and that's one of the easiest ways to see if they have jaundice is the sclera. Alright, so I'm going to look at the ears. So I'll look at both the ears. I'm going to look at the size. I'm going to look at the outside of the ears. I'm going to look at the back of the ears. I'm going to use my pen light, and we're not going to really look inside, but we're just going to make sure they don't have any drainage. Sometimes you can see like earwax in the ear canal there. Also with my pen light, I'm going to look at the nostrils. So I want to make sure they don't have like a deviated septum. What would that mean? Yeah, shifted to one side. So I would want to look for that. Then I'm going to have them open their mouth. I'm going to look all around. So I'm going to look at the teeth. I'm going to look for, cavities. I'm going to look for anything abnormal, any lumps, swelling, redness, drainage, things like that. Then I'm going to look at the neck. I'm just going to look for symmetry. I'm going to palpate those carotids one at a time. Okay, and then I can actually listen with my stethoscope, one at a time. So I'm gonna listen, and then I'll listen on the other side. So I'm gonna be looking at the skin. So I'm gonna be looking for any abnormal coloring, bruises, especially like on older people, you'll see a lot of, petechia, or if they've had, if they're on blood thinner, especially if you've seen elderly people that might have a lot of, like bruised looking skin, especially if they've been in the hospital or something. So we'll just be assessing their skin for things like that. We're gonna look at the pulses on both sides. We're going to assess the radial pulse. We're going to assess the brachial pulse. We're gonna come down here and we're gonna look at the fingers. We're gonna assess circulation. So how are we gonna do that?
Cap refill.
Capillary refill, and it should be
Less than 2 seconds.
about 2 seconds, yes. We're gonna look at the nails also for clubbing. Remember we talked about that? It has the elevated, what's it called? Not circumference. It's greater than 160 degrees if they have clubbing. Okay, so the chest. We're going to uncover the patient's chest. We're going to look for any scars, anything abnormal that might be going on there. We're going to be watching for their breathing. Is it symmetrical when they breathe on each side? So hopefully it will be. So now we're going to listen to the lung sounds, and there's a certain way. We're going to listen anteriorly and posteriorly to the lung sounds. So basically, we're going to start up here, right under the clavicle, right under the shoulder blade, right on top of the clavicle, but it's not on the bone. So we're going to listen here. We're going to listen here. We're going to have the patient take a deep breath. It's kind of a ladder approach, but you're going to go side to side. So we're going to have them take a deep breath. And then if they're able to sit up, we'll have them sit up. We'll listen posteriorly in the same way, kind of like that ladder approach, until you've got the top lobes and the bottom lobes auscultated. So then we can actually, we're going to listen for any adventitious sounds. So we can actually, right here on the, right in this area, we can actually do the skin turgor test. Remember, we're going to pinch their skin up. They say that's the best place to tell about dehydration. So if they're dehydrated, their skin's going to kind of stay standing up. You can do it, on the back of the hand, but this is more accurate, they say. Now, if you'll get your picture of your heart that I sent you, or that I gave you. So, there's a couple of ways you can say, all people enjoy Time magazine. My favorite is all pigs eat too much. I think that's cute. Alright, so, if you'll come down here to about the second intercostal space, that's the aortic. You can listen to the aortic valve right here. If you go straight across to the left side, that's the pulmonic. Down to the third, that's Erb's point. And I think it's the fourth, and that's let's see, tell me, help me.
Tricuspid.
Huh?
Tricuspid.
Tricuspid. And then this is going to be the mitral. This is going to be the point of maximal impulse. So you want to listen to all those places. So then we can actually auscultate for an aortic aneurysm. So this is kind of in this area here. So this would be, aortic bruit. So we'd hear that whoosh sound if it was an aortic bruit. Hopefully we won't hear that. Now, we're going to inspect the abdomen first, right? And we're going to listen to all 4 quads of the abdomen. So we're going to put our stethoscope. So those bowel sounds, we should hear those about every 5 to 25 seconds. So we're going to listen in all 4 quads of the abdomen for those bowel sounds. If we do not hear bowel sounds in 5 minutes, then we can say that they're absent, that they don't have any bowel sounds. If I don't hear bowel sounds, I usually will go and I'm gonna ask another nurse to listen to, just to make sure, you know, that I'm hearing right. So then we are going to, let me go back. It says we can do a breast exam, so we can do that while we're in this chest area. So of course, we're still gonna look for any asymmetry, any abnormal, you know, maybe discharge, discoloration, things like that. So we're gonna check the femoral pulses on each side. So we're gonna come down here. We're gonna look at the legs. So popliteal pulse is gonna be behind the knee. Posterior tibial is gonna be behind the ankle. And dorsalis pedis is right on top of the foot. And you can check these areas out on yourself if you want to. Again, we're gonna check that capillary refill in the toes. We can look for swelling. We can look for any areas of discoloration. We're gonna look on each side. And as far as like perineal areas, of course, you know, for men, we can do a testicular exam. We're just gonna look for any, and for women also, we'll look for like lesions, swelling, discharge drainage, things like that. And you can just verbalize that when you come to do the check off. So in this, you want to look and make sure they're able to move their extremities okay. So we're going to assess mobility. If they have any edema, we would grade the edema like we talked about. You know, 1+, 2+, 3+, 4+. So basically, it's head to toe. So basically, what are you looking for?
Any abnormalities?
Any abnormalities from one side to the other, because every person we know is going to be different, right? Okay, questions? Anybody?